unmarried, does not have any children. She has to pay monthly EMIs for home loan and car. So she does not have any money to buy health insurance. She is young and so likely that her having any medical problem and having usage of health insurance is low. So that way she is saving cost. But one day she starts having dragging sensation in her breast. She has important office target to complete. She ignores the symptom, but now heaviness is increasing and it is associated with lumpy feeling in her breast. She shares it with a neighbor who is a friend, and neighbor tells her that it happens to everyone during menstrual cycle and there is nothing to worry about. She should live her normal life as usual. But now it is also the lesion is growing. It is associated with visibly red skin over the breast and nipple is distorted. So she visits doctor and diagnosis comes as a shock to her, which is carcinoma of breast, which is breast cancer. She is in denial. She is not willing for biopsy to confirm the diagnosis. She visits 5 different doctors for opinions. And that way she wastes another 1.5 months before doing biopsy. Now biopsy confirms the cancer diagnosis, and meanwhile 2 months have already lapsed. So now doctors advised her a PET scan which shows that cancer has spread to her lungs and it has become stage 4. So now doctors tell her that they cannot cure it, but they can start her on some therapy, chemotherapy or targeted or immuno to reduce symptom, to prolong her lifespan and to bring cancer under control. But she is still in denial and she also has financial constraints. Treatment cost is high. So she visits one of the quacks who is giving her guarantee of 100% cure. She starts treatment and takes during initial 15 days to 1 month, she is responding. Her overall physical appetite is increased, physical well-being is increased, anxiety is reduced. So she continues treatment for 2.5 months. And now she has been brought to our emergency room with seizure, which is a convulsion. And evaluation confirms the spread of cancer to her brain. So, to my question, where did she fail? So, I'll briefly go through each and every aspect. What is cancer? So, it is abnormal proliferation of out of order cells. These cells are not functional, so they does not perform the normal organ function, but they, despite not performing any function, they are growing rapidly. So they impair surrounding normal cells functionality and they have capacity to spread to other organs in which we call it as metastasis in our language. So I will focus my discussion on breast and cervical cancer. So if I talk about breast cancer causes, then around 20% of the cases are familial, which means they are transmitted, they run in the family and they are transmitted through the mother or father who has abnormal gene to their offsprings. Now, uh, if one lady who is in her 30s has a breast cancer and no one in the family has history of breast cancer, that does not mean that this cannot be a hereditary cancer. Sometimes genetic mutations occur randomly and matlab that 30-year-old person can be the first person in family to have that mutation and have that cancer, and she has the ability to transmit it to her offsprings. So genetic checkup with through the certain genes, checkup of certain genes like BRCA, PALB2, CHEK2, etc. is required whenever it is indicated by a doctor. There are certain indications when we perform this kind of checkup, and it puts the person not only at increased risk of breast cancer, but also to the ovarian cancer, pancreatic cancer, prostate cancer, and few other cancers. but breast cancer is the most common one. Cervical cancer is not hereditary one, but breast cancer has around 20 to 30% possibility of it being hereditary. Now, it has many implications. One important implication is regarding the treatment for the index patient. So we have many strategies, preventive strategies available. If patient is suffering from breast cancer and her ovaries are normal, she has been found to have BRCA gene mutation, we can advise her to go for surgical removal of her ovaries and her both her breast, which can be reconstructed later on, and this reduces her future chances of developing breast and ovarian cancers. We have certain targeted molecules available, which are given after completion of treatment to reduce chances of recurrences. This has also implications with respect to testing of the offspring and spread of the cancer to siblings and offsprings. So they can also be checked if the patient has these mutation, and they can be started on preventive strategies earliest. Now, other important causes of breast cancer are these are certain factors which are environmental, certain are lifestyle related, and few others. So early menarche. Menarche means starting date of menstruation. So if a girl is having early menarche by the age of 8 or 9 years, she has started menstruating, then it puts her at increased risk of developing breast cancer. Late menopause similarly is also a risk factor. No breastfeeding, oral contraceptive pills, and nulliparity, which means no child. This all the things put patient as increased risk of breast cancer because the same mechanism is working behind all these causes. Increased hormonal exposure. So during pregnancy and breastfeeding, there are certain hormonal changes which are protective against breast cancer. And early menarche means earliest hormone exposure. Late menopause means hormone exposure lasting for longer period of time. No breastfeeding and oral contraceptive pills increase this hormone exposure in your body. And similarly, nulliparity, which means no childbearing, also exposes you to the increased hormonal exposure for prolonged period of time. And this is a risk factor for developing breast cancer. Certain infections are involved in the etiogenesis in the causation of cancers like human papilloma virus infection. Around 70 to 80% of the cervical cancer are HPV related, and HPV is a sexually transmitted infection. So, any sexual activity, particularly in those who have multiple sexual partners or certain practices which put them at high risk of transmission of this HPV infection, are at increased risk. Now, not everyone who is infected with this HPV virus develops cervical cancer. 90% of the HPV infections are self-limited and they generally vanishes over a period of time. But if your immune system is hampered due to one or the other reason, then your body cannot, your body does not clear HPV infection. And long-term HPV infection uh, produces changes in your cervix, which is mouth of your uterus, puts it transforms the cells into cancerous cells, and then later on they evidently become a tumor. Other important risk factors are smoking. Passive smoking is also a similar puts person at similar risk and leads to slow and painful death. Alcohol is also another risk factor, and sedentary lifestyle, which we now call it as a obesity epidemic. This puts person at risk of multiple different cancers. Around 25% of the breast cancer are related to obesity. So being overweight puts you at increased risk. And there are many other causes which we don't know yet, and mystery continues. Now, how do they present? So presentation of breast cancer is just like we discussed. It presents with some dragging sensation in your breast, some uh, feeling of uneasiness or discomfort in your breast. When in advanced stage, it presents with skin changes like redness or thinning of the skin over the lump. It also can present with nipple discharge, distortion of the nipple shape or size, lump in your axilla, asymmetry of your two breasts. It can also produce changes like skin puckering, dimpling, or ulcerations. How do cervical cancer present? So early stage cervical cancer generally does not produce any symptoms, and early stage is the point where we can cure it with high success rate. So it does not produce many symptoms, and we will discuss how can we capture cervical cancer at that stage. In advanced stage, it produces post intercourse. There is a bleeding from vagina, and there are many a times that there is a complaint of painful intercourse. So how can we prevent it? So preventive strategies are the strategies which we start when there is no cancer in your body and we try to prevent it from coming up. So first important thing is quit smoking. Then for cervical cancer, we have now in India also, we government has launched this program, which is HPV vaccination program. I'll discuss this in somewhat detail later on. So uh, vaccine is one of the strategies to prevent cervical cancer, to have safe sexual practices. Education is very important to be aware of the some aware of the symptoms and to know that something abnormal is going on in your body is important to prevent the cancer. Regular health checkups like mammography, they exercise, breastfeeding, diet, and to maintain healthy height. These are all the preventive strategies. So we must become the change we want to see, as told by as told by Gandhiji. So we should be starting this from us and cancer screening strategies. So screening is the way of detecting cancer at the early stage. So many a times you must have seen, you must have heard somewhere that stage 1 cancer has high cure rate. More than 95% of the patients are cured in stage 1 scenario. But less and less time we are diagnosing patients in stage 1 because we are not routinely checking them up. Once the symptoms are produced, the cancer has already become stage 3 or stage 4. And at that time, we are losing a patient, we are losing much of a time. We are uh, experiencing lots of toxicity with treatment, cost with treatment, poorer outcomes. So cancer screening strategies are the strategies to detect cancer in the early stages, like stage 1. So how can we detect breast cancer? We have certain guidelines. First and important thing is breast self-examination. So many a times women come to me and ask that how will we know that something abnormal is going on in our body or there is a tumor in our breast? How will we know that? You must have seen many videos which are available on YouTube that how to perform self breast examination. I will briefly tell you also that you should be examining your breast on monthly basis with the palm of your fingers, just in circular rounded motions. Use your palm of your fingers and uh, feel your breast. If there is something abnormal, you will feel it. First and important thing is to know what is normal for yourself and what your breasts feel like and what is their normal behavior. Once you know you're normal, if there is anything abnormal, you will get to know. And this is not only a one-time thing. You should be monitoring it on monthly basis. And if anything abnormal you feel, you should consult a doctor. Clinical breast examination is the breast examination what we perform in our clinics. Mammography, ultrasound, and MRI. So these are the screening guidelines. So those who are at the routine risk, not at increased risk because of particular reasons like family history or uh, obesity, but those who are at routine risk between the ages of 40 to 75 years, annual clinical breast examination and annual bilateral mammography is the recommended screening strategy. Breast self-examination should start at 20 years of the age and it should be done monthly. Clinical breast examination should be done 3 yearly between the ages of 20 to 40 years. Now coming to cervical cancer. So 70 to 80% of the cervical cancers are human papilloma virus related. And if we see worldwide, more than 90% of the cases are because of this virus. This virus has many different strains, but four important strains, which are HPV 6, 11, and 16, 18, are responsible for majority of the cancers. So, as I discussed previously, 90% of the infections clears by themselves. Our body's immunity kills the HPV virus, and women is clear of the infection. But in 10% of the cases, because of low immunity or whatsoever reason, it stays in your body. And HPV infection has a lag period of around 20 to 30 years. It remains in your body for 20 to 30 years and transforms your cervix into a cancerous tumor. So, this is the great opportunity, first for prevention and second one for screening. So for prevention, because as I told you, HPV is sexually transmitted disease, so we need to vaccinate the girls before they start their sexual activity. Indian government has started a vaccination drive for HPV just around a week back. You must have heard it in the news that government has started from Rajasthan. They are planning to vaccinate all 14-year-old girls with the single dose of HPV vaccine, which is quadrivalent. So it targets all these strains 6, 11, 16, and 18, and which are responsible for more than 90% of the HPV related cancers. And it is only a single dose. After 6 months, we give second dose to some patients, but single dose also gives very good results. Now, once patient has started sexual activity and once he or she is infected with this virus, then there is no point of giving vaccination. So it is important that we vaccinate before they start the sexual activity. Now, another screening strategies. So, as I told you that after infection with HPV virus, there is a lag period of 20 to 30 years. And after a lag period, the cervical mucosa is transformed into a cancer. So, during that lag period, we have some tests like pap smear and HPV DNA cytology. So with that pap smear and HPV virus testing, we can identify the precancerous changes in cervix and we can apply strategies to prevent development of cancer. So pap smear is a simple procedure. It involves gentle scraping of some cells from the surface of cervix, putting them on the slide, and they are examined under microscope to see if they are normal or abnormal. So for cervical cancer, at age less than 21 years, there is no screening is recommended. Between 21 to 30 years, pap smear is recommended every 3-year interval. Between age 30 to 65 years, pap smear is recommended every 3 years, or pap smear in combination with HPV testing is recommended at every 5-year interval. And after the age of 65 years, no screening is recommended. Why? Because the lag period which we want during that time we want to capture HPV in early stage is already gone. Now, another important thing is role of health insurance. So, as you all know that cancer treatment is getting costlier day by day. Though I will try to break that myth later on during the presentation, but yes, some of the cancer treatments are costly because of patent issues by the companies which have invented them. So it is always recommended to have a health insurance as soon as you start earning. At the age of 20 to 25 years, your yearly insurance costs you less than 5,000. So it is highly recommended because you never know that when cancer will happen, who will develop it. Young patients can also develop cancer. So it plays very important part in your treatment journey. So now let's break some myths. There are very uh, there are many myths prevailing in the community, especially in the villages, but not only in the villages. Metro cities also has these myths which are going on, and we need to know that cancer treatment, cancer diagnosis are not that scary. So there is this myth that cancer is contagious. I can assure you that cooking for yourself, cooking for your family, eating with your family, doing all your household work, living with your family is safe during cancer treatment. And there is nothing excess risk involved in all these activities to your family. In fact, it emotionally strengthens you and increases your chances of recovery. Now, many a times people believe that once the diagnosis is there, it means death. And to rectify that myth, we have many examples like Yuvraj Singh, Sanjay Dutt, Sonali Bendre. I will also share a journey of close friend. She is Miss Komal. She was diagnosed with cancer in 2006 at the age of 13 years, and she underwent chemotherapy. Despite a relapse, she continued her education. She was studying for her 10th and 12th board exams while undergoing treatment. And in 2016, she underwent bone marrow transplant and continued her academic journey. She successfully completed her master's in clinical research, and now she is a research assistant in the BMT unit, bone marrow transplant unit at Tata Memorial Center. While working, she is also preparing for her PhD and continuing to turn her trials into triumphs. So this is a close friend of mine and who is an bravest example, who is the bravest person whom I know. She has conquered the cancer and she has not given up on her dreams. There is another myth which is cancer means costly treatment. So there many examples I can give that cancer treatment is not costly. In hormone positive breast cancer, monthly treatment cost with oral tablet is 600 rupees only. And one beer costs us 500 rupees a day. So cancer treatment with the government interventions has come down significantly. But there are also certain government schemes which are running which help you to go through the treatment, Ayushman Bharat PMJY. But it is important to have insurance. Now, another myth which is prevailing is cancer treatment means compulsory break from work. So, yes, cancer surgeries require short term breaks, but now we have advanced options like robotic surgery or minimally invasive surgery, in which patient is discharged on day 3 of the surgery and patient is mobile on after 24 hours of the surgery, discharged on day 3, stitches are removed on day 7 and can resume work by day 10. So it requires only short break. No major lapses in your work are required. While chemotherapy is going on, one can continue to work while chemotherapy is going on. We have now very good supportive care regimens available like cooling caps, which help you to retain your hair during chemotherapy. And not all chemotherapy regimens cause hair loss. We now have very good drugs to prevent nausea and vomiting. We have now drugs to which can prevent the blood count drop after chemotherapy. So, with all this supportive care, now you can continue to work when your chemotherapy is going on. And radiation therapy is a 5-minute procedure only. So, definitely you can daily go to work and continue radiation. Another important myth is cancer means surgery always, or cancer means disfigurement of body parts via surgery. So, if I share a few examples, many of women in village don't come forward with breast lump because they are afraid that once they are diagnosed with cancer, their breast will be removed and it will cause lot of body image issues. But now we have breast conservation surgeries available in which only a part of your breast is removed which contains tumor and your entire breast is not removed. So it does not always mean that there will be disfigurement of body parts. I can share other examples also like rectal cancer or blood cancer, laryngeal cancer, cervical cancer. In cervical cancer, many a times treatment of choice is chemoradiation therapy. It does not require any surgery and cure rates are more than 70%. So cancer does not always mean surgery. This is also important myth that lump in young people is not cancer. We are now seeing many young women, highest incidence of cancer is now seen in young women. I have more than 10 young ladies, less than age of 40 years, going ahead with chemotherapy right now with me. So incidence is increasing. Many a times they are in denial after the diagnosis that it cannot happen to me or why me, why God did this to me, all those things. They lead to delay in diagnosis, delay in starting treatment, and overall impairs our treatment related outcomes. So if I describe the graph for you, in which we can see that first red line is stage 1 cancer. So in prostate, breast, stomach, colorectal, lung, everywhere the outcomes in stage 1 cancer are more than 90%, at least for breast and prostate cancer. But as we reach to stage 4, the outcomes are going less and less, survival is impaired, and they have 20%, 40%, 10-year survival rate. So early diagnosis help us to preserve life and preserve also not only just your life but also quality of life because treatment is less intensive. In early stage cancers, cure rates are high. Cancer treatment is painful. So this is individualized perception. But to be, one should always remain positive and should encourage, should go through that phase very bravely because side effects are temporary and generally are not life threatening. And aggressive treatments are only given when cure rates are high. In metastatic, which is stage 4 setting, we always consider quality of life as an important parameter and we do not give the treatments which have high side effects. And this was another myth which was uh, India-wide motion created by Mr. Navjot Kaur Sidhu. So he shared it in one of the reels that diet change cured his wife's cancer. But if we listen to that reel carefully and in detail, his wife already completed surgery, chemotherapy, radiation therapy, everything. So diet change can supplement your cure journey, but it cannot replace the main treatment, which is surgery, chemo, and radiation. So this is this after this video, we are seeing on daily basis in our clinic. Many patients are coming that what diet should we follow? How can we not take all this treatment and we can make it change in diet and we can cure the cancer? But the right information, media is also very plays very important role, and right information should be circulated to all, and there should be restrictions regarding what they are what as a public figure people are speaking. And there are many such more myths, but to conclude, cancer is preventable before diagnosis, and after diagnosis many cancers are curable, and remaining incurable cancers we can prolong life with comfort. Thank you all, and any questions you can just ask me. So at Paras, we have facilities for comprehensive cancer care, for prevention, diagnosis, treatment, and follow-ups, and it requires team effort. So we have a great team of surgeon, medical oncologist, radiation oncologist, interventional diagnostician, radiologist, facilities for everything, PET scan, MRI, mammography. We have a trained staff who is very capable of dealing all the chemotherapy, administering all the chemotherapy, targeted therapy, immunotherapy, medicines. So I thank all of them for uh, making our work fruitful.